this assignment was given, I guess, last week. Assignment on a diabetic diet plan for a 60-year-old male. Weight was 96 kg. Height 166 centimeters. Sedentary lifestyle. Protein, we had a target to keep protein at least 80 grams per day. Small frequent meals, complex carbohydrates and fiber should be the focus. Vegetarian and non-vegetarian diet plan both had to be made. Okay, so few students had submitted their assignment to me on WhatsApp that I had put in the put on here. Some may have mailed it to the assignment at nhca.in. I haven't put those assignments here, just to give you an understanding on how diet plans are made. It is very easy to make the diet plans. Okay, you just googling, if you use Google or use internet to find out diet chart for diabetes, for weight loss, you will get n number of diet plan freely available. But the concept behind it, how to make a diet plan, that is what you learn in this course. Okay, using formulas, using various guidelines from different chapters given in your textbook. Okay, these are the essential parts. Okay, putting recipes and meals together is very easy. Okay, so the assignments that I have received before 12 p.m. today, I have put those assignments only. After this, we'll continue with the nutritional anemia chapter of dietetics. So just let me know in the chat box what was the calories that you you received from this particular information. The students who are new here, don't worry about all this. We will discuss all the topics all over again within few weeks. We'll do menu planning, energy balance, diet and obesity. Okay, these chapters will be done, so you will understand how the diet plan is done. So this is for a male. I have not mentioned the gender here, but it was for a male, 60-year age. 96 was the weight. Height is 166 centimeter. Sedentary lifestyle. And we are focusing on weight loss as well. Okay, weight loss, because you will see if you do the BMI, whenever you get this information directly before jumping on St. George and Mifflin formula, it's better you do the BMI first. Okay, if you do the BMI here, you will understand the person is obese, right? So you have to reduce 500 kilocalories. He is obese and he is diabetic, so definitely weight loss should be a target here. Okay, and don't forget to do the second step. Second step is when you multiply the BMR by sedentary lifestyle. Yes, page number, this is not page number, this is just the assignments done by the students. Okay, so the calories is approximately around 1500. Okay, calories are approximately around 1500. You can do the roundup of 1500. Okay, giving them a calorie target per day of 1500, which should satisfy the need. Okay, so since it is 1500, okay, even if for future reference, always remember, if anybody's calorie, that target calorie is 1500 or less than 1500, they will require some nutritional supplements. Okay, multivitamin, mineral supplements will be required, because 1500 kilocalories per day in today's diet, okay, even if it is home-based diet, it will not satisfy the micro mineral requirement, micronutrient requirement okay, based on the RDA. So multivitamin tablets will be required. Okay. No, so no, we don't have to consider that with age, appetite reduces, because the BMR formula, it itself has the age factor in it. Okay. The BMR formula that you do in step 1, already it has age factor in that. Okay. So you don't have to specifically consider the appetite reduction until and unless it's very subjective. Okay, it could be subjective because the maybe the person whom you are dealing with had a throat surgery, okay, had oral cancer, they have swallowing issues, okay, they are undergoing a lot of stress, some personal issues that could suffice as loss of appetite, some psychological issues that can suffice as loss of appetite. Okay, only in subjective cases you may have to do some combinations in the diet plan. Otherwise, you don't have to consider the loss of appetite with age, because BMR formula itself depends on age. Okay. First, do the BMR. When to calculate the calories, first do the BMR, multiply it with the lifestyle, personal activity level. Okay. And if required, check the BMI and see if the person is obese or not. If the person is obese, direct them to lose weight. Okay. Minus 500 kilocalories. If the person is healthy, not obese, weight maintenance, stop right there. Okay. Stop at step 2. That's it. BMR multiplied by the personal activity level. That's it for weight maintenance. Okay. So the first, Vinita Pandya had given the assignment. This is the vegetarian diet that she has done. Calories she hasn't mentioned, but almost, if you look at the entire, is it visible to all? The calorie range is between 1400 to 1500 kilocalories, which is pretty good. And protein she has maintained around 80 to 85 gram. That is also good. 180 gram of complex carbohydrates throughout the day. 20 to 30 gram of fat. That is also fine. So it's a vegetarian diet. Starts from 6 a.m. and ends till 9 p.m. Turmeric milk, you can give them around 8 p.m. Okay, that would be much better, so that you can put the patient put the person from 8 p.m. or 9 p.m. onwards till the next morning 6 a.m. If the person is fasting, it is good. Even if they are diabetic, 9 p.m. to 6 p.m. 6 a.m. of fasting is completely fine, because we are focusing on weight loss as well. So moong dal, methi paratha. Okay. Parathas you can switch for different days of the day. So one day moong dal chila, or one day besan ka chila, methi paratha, aloo paratha, whatever parathas you can switch. Okay. Instead of aloo, you can give gobi paratha, other forms of parathas. So you can get an entire 1 week's meal plan out of it. Fruits and seeds daily, seasonal fruits and seeds. Sabjis here can change. Dal can change. Okay. So adding tofu and soya chunks in at night is good. Reduce the spice. Okay, for dinner, reduce the spice. But tofu and soya chunks are good. Good sources of protein. And this is a vegetarian diet plan. I'll show you the non-vegetarian later. Next is non-vegetarian. Fenugreek seed water is added in both the diets, which is good. Okay, fenugreek seed water on empty stomach for diabetics is good. If the person has cholesterol, okay, Having garlic water in the morning is good. Puffed rice is better to avoid if the person is diabetes because it has a high glycemic index. Makhana is fine. Puffed rice you can avoid. Grams she has not mentioned. Other students have mentioned, I guess. But here total grams of protein she has mentioned in the side for vegetarian. Non-vegetarian would be somewhere nearby, but protein would be slightly higher, I guess, in non-vegetarian. Next assignment submitted by Kirby. Is the handwriting visible to all? If you have any doubts, just put in the chat box. Is Kirby present in the class today? Please mention in the chat box. Yeah, Kirby is present. If you have any doubt regarding the meal plan, just put in the chat box. Any recipe issues or anything like that. Calories you have to reduce. Okay. Total calories of this meal plan is 1600, which is fine. Okay. The uh, vegetarian diet plan is giving 1600. That is fine, even though your target is 1500. 100 kcal calories plus or minus is fine. Okay. And encourage physical activity as well. This is a non-vegetarian meal plan. Sugar-free protein bars will be fine. Yogurt and curd are slightly different because see, curd you can make curd at home by curdling milk. Okay, you take the lactose bacilli which is present in the curd, put it in milk, you will get a curdled milk. Okay, for yogurt it is more fermentation based. Okay, artificial acids are added into milk to enhance the fermentation of milk, and that's how you get yogurt. Yogurt is more creamier as compared to curd. Here in non-vegetarian diet, portion control has to be done to reduce the calorie intake, to target a calorie intake of 1600. That is also fine with non-vegetarian diet. Next is given by Prabjot Kaur. Vegetarian diet. Simple. Breakfast is besan ka chila and curd. So protein requirement is done with breakfast. Tea without sugar. But you have to mention if it is milk tea or green tea or black tea, because calories differ. Okay. Milk tea will have higher calories. Apple can be, diabetic people can have apple. Some fruits are there which diabetic people can't have, like custard apple and all that has to be avoided. Low glycemic index fruits they can enjoy. Calories would be almost around 1600 here, 1500, not more than that. She has not mentioned it. If you don't have issues with gluten and you're not allergic to the chickpea, you're completely fine. You can have besan uh, two times. Ghee is bottle gourd, dudi. Okay. Bottle gourd is called ghee. This is a non-vegetarian diet. Instead of vegetable soup, you can go with a non-vegetarian soup like chicken soup or a bone broth, something like that. That will add more protein into the diet. Okay. Because here protein, I think it is lacking. In dinner, protein is lacking. Soya beans also you can add something soya based. Since it's a non-vegetarian diet, they can have something non-veg as well. Next is given by Gurpreet Kaur, non-vegetarian diet. Calories you have to reduce a bit, aiming for weight loss. All the students who haven't had added fenugreek water, it's better you can add fenugreek water early morning, empty stomach. It is beneficial to the diabetic client. Okay. Almonds and walnuts you don't have to soak. It's not compulsory. Okay. Pulses and legumes you have to soak. That can remove the oxalates and phytates. Okay. But almonds and walnut, unsoaked one also you can have. It is equally beneficial. It is better to have them separate. Fenugreek water you can have 10 minutes before any meal. Okay, any meal, even before breakfast, 10 minutes before breakfast. 10 minutes before lunch, okay, 10 minutes before dinner, you can have fenugreek water, okay. For cholesterol, if you have a client who has cholesterol and diabetes, give priority to have garlic water early in the morning, empty stomach. Fenugreek water, they can keep drinking it throughout the day just before meals, okay. Garlic water, you just have to crush garlic, add hot water into it, let it cool down, and then have drink it. That's how you make garlic water. Very simple. And also, yeah, fenugreek powder you can add in buttermilk. You can do that. Okay, people do that actually during lunch. Diabetic people with during lunch, instead of having fenugreek water, they will have roasted fenugreek powder that they will add into buttermilk and drink it. And try to incorporate more fenugreek seeds or fenugreek powder in the subsies and meals, whatever you prepare for the diabetic patient. Also, in general, that can control your blood glucose level. Yeah, garlic water is fine. It will not treat your cholesterol. It will prevent certain risk. Okay, it will try to bring down your cholesterol very minutely. It aids for your anti-cholesterol drugs to work better. Okay, you can't expect garlic water to cure cholesterol issues. Next assignment is given by Shruti. If you have a risk of diabetes running in your family, both the parents are diabetic, grandparents from both the sides are diabetic, it's better you can start incorporating more fenugreek in your diet. Even though if it is fenugreek water, it's better. It will not do any harm. So like this, you have to mention tea or coffee. Is it with milk or without milk? Shruti has mentioned here. Don't keep rotis and rice together. For a diabetic patient, don't keep both of them together. Keep any one, either roti or rice. Okay. And rice, it is better to go with brown rice or parboiled rice. Having rotis and rice together, that will give a carbohydrate load. Okay. Specifically, if it is just wheat roti and white rice, carbohydrate load is high. Okay. So if it is a multigrain roti, it is fine. One multigrain roti and some rice, it is fine. Two rotis and 1 cup rice, that increases the carbohydrate load. Okay. And this is the non-vegetarian diet. Add more millets. Okay, like ragi dosa you have added, it's a good thing. Ragi, having more millets is good. Even in roti, small correction, if roti is made up of multigrain, like ragi, jowar, multigrain roti, it's better. And rice, go for parboiled one. Since you have not mentioned, it's just an additional information. And keep rotis and rice separate. Okay, like not in the same meal. And instead of suji upma, you can keep rice at night. Okay, suji is high energy, it's high calorie. Okay, suji is high calorie, high energy. At night, the protein content is less in this dinner, so it's better to keep rice or curd rice or rice and with some chicken curry. Okay, at night it is better. Moringa leaves are good in folic acid and iron and all the vitamin B complexes as well. But I'm not sure if they are anti-diabetic in nature. This is submitted by Dr. Kripa. So in lunch, in dinner, she has kept it as a raw breakfast, uncooked raw breakfast, which is a good thing. It adds more fiber. You can start the day with fiber-rich food. Here she has mentioned roti, which is multigrain, which is good. Okay, millets are there in the diet. Next is a non-vegetarian diet. In non-vegetarian diet, it was easier to get up to 80 gram protein. Vegetarian diet, 20 gram protein was lacking. You can add, if it is a vegetarian diet, you can add protein powder. Okay. Plant-based or whey protein powder, whichever you can add. Unsweetened one is also available. Okay, that can be added in vegetarian diet. So that's all for today. I guess it's